Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I talked about 5 signs to look out for when it's time to let go if your loved one is critically ill and is dying in intensive care. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to talk about having your loved one critically ill in intensive care. Follow your gut and intuition. Before I get into today's topic, I want to share a quote with you that I wrote on today's topic, and the quote says, "Your gut feeling and intuition never lies." The species of us human beings has been equipped with our innate gut feeling and intuition for over millions of years. Our gut feeling and intuition has helped us, as well as our ancestors, to survive, often against many odds. Imagine one of your ancestors living in the wilderness without any of the luxuries that we know and appreciate today. They had to successfully rely on their gut and intuition. And it must have served them well. Otherwise, they wouldn't have survived, and you wouldn't be here today. Society in this day and age places way too much emphasis on research, science, and the perceived power and the perceived authority that comes along with it. That's how society gets brainwashed in today's modern age, and it goes further away from what our ancestors had to successfully rely on for their and our very survival and reproduction. One of your biggest assets when your loved one is critically ill in intensive care is your gut feeling and intuition. It often goes against what everybody else is trying to tell you, including the intensive care team. And it often goes against the negativity and the doom and gloom that you get when your loved one is critically ill in intensive care. Trust your gut and intuition, even when other people are trying to convince you of something else, because your gut and intuition never lies. So, let's get into today's topic. When your loved one is critically ill in intensive care, there's a very good chance that you feel confused, emotional, stressed, vulnerable, frustrated, fearful, and way outside of your comfort zone. But more importantly, if your critically ill loved one is either very unstable and in a very critical condition, or is in a life-threatening situation, or is in intensive care for long-term treatments and long-term stays, including long-term ventilation, or your critically ill loved one may be having a severe or traumatic head or brain injury, or your critically ill loved one may be threatened with an NFR, not for resuscitation, or DNR, do not resuscitate order, or your critically ill loved one may be in a situation where the intensive care team suggests that a withdrawal of treatment or a limitation of treatment may be, quote unquote, in the best interest for your critically ill loved one. Or your critically ill loved one may even be approaching their end of life in intensive care. The bottom line is that if you are finding that your critically ill loved one is in one of those challenging, difficult, frustrating, and often heartbreaking situations, you need to quickly find ways and strategies that work in order to become a master of your own and your critically ill loved one's destiny. The fact of the matter is that if you are like 99% of the families of critically ill patients in intensive care, who have no peace of mind, no control, no power and no influence, you will buy into the doom and gloom as well as the negativity from the intensive care team. Even worse, if you are like 99% of the families of critically ill patients in intensive care, who have no peace of mind, no control, no power and no influence, you and your family are intimidated by the perceived power and the perceived authority of the intensive care team. In fact, the 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power and no influence leave one of the most critical elements and one of their biggest assets on the table when their loved one is critically ill in intensive care. The 99% of families of critically ill patients in intensive care who have no peace of mind, no control, no power and no influence never listen to their gut and they never listen to their intuition. And after more than 15 years intensive care nursing in 3 different countries, where I literally worked with thousands of critically ill patients and their families, and where I also worked as a nurse unit manager for more than 5 years, I have literally seen the difference between the very few families of critically ill patients in intensive care who had peace of mind, control, power and influence, compared to the 99% of families of critically ill patients in intensive care who don't. If anything, the 99% of families of critically ill patients in intensive care feel intimidated by the perceived power and the perceived authority of the intensive care team, which often leads to them making decisions without taking your opinions and your feelings into account. If anything, the intensive care team doesn't even want to know about your gut feeling and intuition, because all they focus on is their medical jargon, or they may refer to medical research and studies that they have done that may or may not be applicable to your critically ill loved one's situation. The bottom line is that the intensive care team is often looking at the hard, cold facts, as well as their often hidden agenda that you know nothing about. Your gut feelings, your trust in yourself and your intuition is something that can be your biggest assets in a crisis situation where your loved one is critically ill in intensive care. I'll give you a real-world example so that you know and understand what I'm really talking about. A few years back, I was looking after this 72-year-old gentleman in intensive care whose heart had stopped after he had cardiac surgery or open heart surgery, and he needed to be resuscitated for a prolonged period of time. On top of that, he ended up with a stroke. He was in kidney failure and he needed the hemodialysis for his kidney failure. The odds, in fact, were pretty much against the 72-year-old gentleman, and the odds were pretty much against his family to see him recovering from this severe critical illness after cardiac surgery and the life-threatening complications he suffered on top of that. The intensive care team was adamant that this 72-year-old gentleman, husband, father, grandfather, brother and uncle was doomed, and the intensive care team had already made up their mind that pursuing treating him was not in this 72-year-old man's and his family's best interest. In fact, the intensive care team framed and positioned the 72-year-old gentleman's diagnosis and prognosis as a situation where a withdrawal of treatment, a limitation of treatment, as well as signing a DNR, a do not resuscitate order, would be quote-unquote in the best interest of this 72-year-old man. This positioning and framing by the intensive care team is one that happens way too often in the intensive care world. And it often happens because there are way too many things happening in intensive care behind the scenes that you and other families of critically ill patients in intensive care have no idea about. Intensive care teams often don't have the stamina. They don't want to invest the financial as well as the emotional resources that it takes to get somebody from the brink of death to survival and a meaningful recovery. Getting back to the story of this 72-year-old gentleman, the man's family was extremely shocked by the positioning of the intensive care team. However, the family was extremely determined to get their critically ill loved one out of intensive care and give him every opportunity for survival and a meaningful recovery. The man's family wasn't buying into the negativity and the doom and gloom of the intensive care team. The 72-year-old man's family wasn't even second-guessing their opinion about their loved one's situation. And it was crystal clear that no matter the situation and that no matter the odds, they believed in not only the survival of their husband, father, grandfather, brother and uncle, they also believed in a meaningful recovery for him. The intensive care team continued in their negative positioning of the 72-year-old man's diagnosis and prognosis, and they continued to impose their expert status, their perceived power and their perceived authority onto this family in order to get them to agree to a withdrawal of treatment and to a limitation of treatment as being quote-unquote in the best interest of their critically ill loved one. The intensive care team was trying to manage the family so that they got to agree with their mainly hidden agenda. And this strategy usually works well for intensive care teams, with 99% of the families of critically ill patients in intensive care, because 99% of the families in intensive care don't have peace of mind, they don't have any control, they don't have any power, and they simply don't have any influence. And 99% of the families of critically ill patients in intensive care don't question, they don't position themselves and their critically ill loved one correctly, and worst of all, they simply are intimidated by the perceived power and the perceived authority of the intensive care team. Coming back to this 72-year-old critically ill man and his family, the family believed again not only in his survival, they also believed in a meaningful recovery of their loved one. Why did the family believe in their gut and intuition? They believed in the stamina of their critically ill loved one, and they had this unwavering belief that their critically ill loved one would beat the odds like he has done many times before. The family of this 72-year-old man knew that because he survived cancer in his early 60s, that he would survive this challenge as well. They just knew, and they wouldn't have anybody else interfere in their beliefs. The family in essence trusted their gut feeling and their intuition against all predictions and against all odds. And if this family didn't believe in their gut feeling and their intuition, the chances for this man's survival would have been pretty slim, because the intensive care team was ready to proceed very quickly with the withdrawal of treatment and with the withdrawal of life support as being quote-unquote in the best interest of this 72-year-old gentleman. However, in this situation, the intensive care team was unsuccessful in selling to the family that a withdrawal of treatment and a withdrawal or a limitation of life support was in the best interest of their critically ill loved one. This family certainly didn't budge, and they were ready to challenge the intensive care team on every level, and they were ready to have their loved one transferred to another intensive care unit to give their critically ill loved one a fair chance for survival and a meaningful recovery. In the end, the intensive care team reluctantly gave this man a shot, so to speak, and after a long 3 months in intensive care, with many ups and downs and many challenges, the man finally left the ICU in a position where he not only survived, but where he was in a position to have and go on to a meaningful recovery. His stay in intensive care was certainly challenging, with many weeks on the ventilator and tracheostomy as well as kidney dialysis. However, his family trusted their gut and intuition, and in the end they were right. Trusting your gut and intuition is often your only option when your back is against the wall. So, how can you become the best advocate for your critically ill loved one, and how can you get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, where I answer your questions, or send me an email to support@intensivecarehotline.com with your questions. Or you can call us. Find our phone numbers on our Contacts tab. Also check out our product section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting with me via Skype, over the phone or via email by clicking on the Products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.